There is a moment in every examination room I have ever worked in that happens before the patient says a word. Before they describe the fatigue, before they mention the shortness of breath, I look at their hands. Not because I am performing a ritual, because the hands answer before the person knows the question has been asked. Your nails are not decorative. They are a continuous biological record, written in protein and pigment and the precise architecture of living tissue, updated every single day by processes happening deep inside your fingertips. Right now, that record is current. The question is whether you know how to read it. Most people do not. And the gap between knowing how to read this record and not knowing has, in some cases I have witnessed directly, been the gap between early detection and a diagnosis that came too late. I want to close that gap for you today. Let me start with the structure, because you cannot interpret a signal you do not understand the source of. Beneath what you can see, beneath the hard, flat surface you press against a keyboard or hold a glass with, there is a small factory. It sits at the base of your nail, hidden entirely beneath skin, and it is called the nail matrix. Every cell in your nail plate was produced in this matrix, somewhere between 2 and 6 millimeters behind your cuticle, where you cannot see it. The matrix is exquisitely sensitive. It is connected to your circulatory system, to your hormonal system, to your nutritional reserves. When any of those systems experiences a disruption, a sharp illness, a weeks-long deficiency, an autoimmune flare, the matrix registers it immediately and changes what it produces. Over the following weeks and months, as the nail plate grows forward at roughly 3 millimeters per month, that change travels visibly toward the tip of your finger. This is why a nail can show you something that happened 3 months ago. The fever broke, the surgery healed, the crash diet ended, but the record of it is still growing forward, still legible, still there on your hand right now. Run your thumb along the surface of your index fingernail right now. Not just a glance. Actually run the pad of your thumb from base to tip. What do you feel? Smooth? A faint ridge or two running lengthwise, or a groove that goes across the width of the nail? A dip you can feel rather than just see. What your thumb just told you in 2 seconds is more precise than what most visual inspections catch. The signal that most people see and most reliably misread is the white spot. Small, irregular, pale marks scattered on 1 or 2 nails. You were probably told at some point that this means you are low on calcium. It is repeated constantly. It is also completely wrong. What you are actually looking at are tiny pockets of air that became trapped between the layers of the nail plate during formation. The matrix produces the nail in compressed layers, like sheets of very fine veneer bonded together, and if the matrix receives even a minor mechanical shock, you knocked your finger against a counter, you pressed too hard, trimming the cuticle, those layers seal together imperfectly, leaving microscopic air pockets that scatter light as white. The reason they appear weeks after the injury is growth time. You hit your finger in February. The record of it reaches the visible nail in April. The cause is long forgotten. This matters because the misattribution is not harmless. If you believe white spots mean calcium deficiency, you will buy supplements and feel you have addressed the problem, while the actual signals worth looking for go unnoticed. The white marks that do matter look different. They are not spots. They are bands, lines running horizontally across the full width of the nail, parallel to the base rather than running lengthwise. One such line on one nail might mean little. 2 or more of these lines at the same position across multiple nails simultaneously is a different situation entirely. These are called Mises lines, and they indicate that the entire nail matrix was disrupted at the same moment across all fingers. A systemic event, not a local mechanical one. Heavy metal toxicity, severe kidney disease, chemotherapy, and profound nutritional deficiency have all been documented to produce them. They sit there, parallel and pale, recording a moment your body went through something serious. A patient I saw several years ago, a retired teacher in her mid-60s, came in for persistent tiredness. She had not noticed the bands on her nails. She had been told by a previous provider that her labs were basically fine. When I pointed out the lines and we looked further, her kidney function told a different story. The lines were not the diagnosis. They were the question that led to the diagnosis. That is what nails do. They do not tell you what is wrong. They tell you where to look. Now, look at the base of your nail, at the pale crescent sitting just above the cuticle. In Latin, it is called the lunula. the little moon. Hold your hand up with the nail facing you and find it. Most visible on the thumb, sometimes visible on the index, and middle finger, often faint on the ring, and pinky in healthy adults. Most people find their lunula unremarkable, but this small pale arc is actually the visible portion of the nail matrix itself, the only part of the manufacturing zone you can directly observe, and its characteristics carry more information than most people imagine. If you have always had a visible lunula, and it has recently disappeared, shrunken, retreated beneath the cuticle, gone from fingers where it used to be clearly present, this is worth pursuing. Diminished lunulae are associated with iron deficiency anemia, hypothyroidism, and malnutrition. If it is grown, now occupying more than a third of the nail plate, that is the opposite situation. Hyperthyroidism, or occasionally excess biotin supplementation, driving matrix activity harder than it should. But there is one color change in the lunula I want to be specific about because it is rare enough that most people have never heard of it. A blue-gray tint in the lunula, not the whole nail, but specifically the pale crescent, taking on a bluish cast, has been documented in Wilson's disease, a genetic disorder that causes copper to accumulate in the liver and the brain. The nail finding can appear earlier than other symptoms, and in an adult who has never been tested, it can be the first visible sign that something has been quietly wrong for years. What color is your lunula right now? If you have never consciously looked before, look now. Now, consider the overall color of your nail plate in good light. In a person with adequate circulation, adequate hemoglobin, and a functioning liver, the nail plate is translucent. The pink you see is not the nail, it is the blood supply flowing through the nail bed beneath it, visible through the clear plate above. This means that the color of your nails is literally a live readout of your blood. When hemoglobin concentration falls, that is as it does in iron deficiency anemia, which remains dramatically underdiagnosed in adults over 50. The pink pales. Significantly anemic nails look almost white, not all at once, not dramatically, but progressively over months. Press on your nail until it blanches, then release. The color should rush back in under 2 seconds. If it takes longer, your peripheral circulation is not moving efficiently. Yellow nails mean something different, and what they mean depends on the kind of yellow you are looking at. A dull, slightly thickened yellowish tint near the free edge, the tip, the part you trim, is almost certainly a fungal infection. Left untreated, particularly in someone with diabetes or compromised circulation, a fungal nail infection is an entry point for bacterial infection in tissue that may not heal easily. A uniform yellow affecting all 20 nails, accompanied by dramatically slowed growth and disappearing cuticles, is associated with failure of the lymphatic drainage system. Yellow nail syndrome develops slowly in pieces, and the nails are frequently the first piece someone notices and dismisses as cosmetic. Do not dismiss it. There is one nail finding I want you to remember above all others today, because it is the one most often treated as trivial and most likely to be anything but. A dark vertical stripe running from the base of the nail to the tip, a narrow line, brown to black, that appears in the longitudinal direction. This is common in people with darker skin tones and is, in that context, usually a benign activation of pigment-producing cells within the matrix. But subungual melanoma that develops beneath the nail, also for stands exactly this way, and it is among the most dangerous skin cancers precisely because it hides in plain sight, beneath the nail plate, frequently mistaken for a bruise or a normal dark line. Here is what distinguishes a stripe that needs immediate evaluation from one that does not. Width is the first indicator. A stripe wider than 3 millimeters deserves professional assessment, particularly if it has widened recently. A line with clean parallel edges is more reassuring than one with smudged or irregular margins. But the finding that should send you to a dermatologist the same week, not when it is convenient, is when the pigment extends beyond the edge of the nail plate onto the skin of the finger itself. When the color bleeds out of the nail onto the surrounding skin, that is a conversation you must have with a specialist without delay. Write this down now, or say it to yourself so it stays. I have a dark stripe on my nail that I'd like you to look at. That is a sentence to bring to your doctor, not at the appointment scheduled 6 months from now, but one you book specifically for this. Most dark stripes are benign, some are not. The ones that are not do not improve with watching and waiting. Now I want you to do something with me. Bring your hands up in front of you and look at your fingers from the side, not looking down at the tops of the nails, but from the side, as if you were about to mime holding a glass. In a healthy nail, the angle between the skin of the finger and the base of the nail is less than 180 degrees. The nail grows out at a slight downward tilt. Now bring the same finger from the other hand next to it, nail to nail, base to base. If there is a small diamond-shaped gap of light between the bases of the two nails, your nail growth angle is in the normal range. This is called Shamroth's window, and it takes about 4 seconds to check. If there is no gap, if the bases press flush against each other, curving over the tip of the finger. This is called clubbing. Feel the tip of your finger now. Is it thicker than it should be? Does it feel soft? Slightly padded beneath the nail. Clubbing happens when the soft tissue of the fingertip proliferates, stimulated by specific signals that circulate when certain organs are not functioning correctly. The conditions associated with clubbing include lung disease, pulmonary fibrosis, lung cancer, chronic chest infections, as well as congenital heart conditions, cirrhosis, and inflammatory bowel disease. The nail is not sick. The nail is a gauge, and the gauge is pointing towards something that needs investigation. Look at the light now. Either it is there or it is not. A groove running horizontally across the nail from one side to the other, cutting across the direction of growth, is called a Bow's line. Run your thumbnail gently along the surface of the nail on the adjacent finger. You will feel it before you see it clearly. A transverse groove, a dent across the plate. Bow's lines form when the nail matrix temporarily stops or sharply slows its production in response to a major physiological event. High fevers, surgeries, serious infections, severe nutritional depletion, certain chemotherapy agents, all can interrupt matrix activity sharply enough to leave a visible groove. The groove then grows forward at 3 millimeters per month, and by the time you notice it, the event that caused it is approximately as many months in the past as the line is millimeters from the base of the nail. A woman I saw some years ago had a clear Bow's line on every finger, all at the same distance from the base, about 12 millimeters. She had not had surgery, had not had a serious illness she knew of. When we talked more carefully, she described a period of extreme dietary restriction 4 months earlier. Not what she called disorder, just a few weeks of eating almost nothing because she had been under extraordinary pressure at work and had stopped being hungry. 4 months at 3 millimeters per month, 12 millimeters. Her body had recorded weeks of starvation in the architecture of her nails, and the record was still growing toward me across the examination table. Now remove your socks and look at your toenails. A toenail takes 12 to 18 months to grow from matrix to tip, compared to 4 to 6 months for a fingernail. What you are looking at on your toes may represent a 1.5 years of biological history. The most common toenail finding that people dismiss is thickening. Nails that have become progressively denser, more yellow, more difficult to trim. The new normal established so slowly that the original nail is no longer remembered. 2 mechanisms drive this most frequently. The first is onychomycosis, fungal colonization, which penetrates deeply into the plate and accelerates architectural breakdown. The second is vascular insufficiency, the gradual narrowing of arteries supplying the foot, most commonly from atherosclerosis or years of elevated blood glucose. A fungal infection in someone with significantly compromised circulation is not simply a nail problem. It is a portal. The skin around a distorted, infected toenail in a person with poorly controlled blood sugar can break down in ways that do not heal easily. And the consequences of that cascade are not cosmetic. Check this now. Press your thumb firmly on the nail of your big toe until the color goes white. Hold for 3 seconds. Release. Count how long it takes for the normal color to return. Less than 2 seconds. Your circulation to that toe is adequate. 2 seconds or more. Your peripheral circulation deserves evaluation. This test is used in emergency medicine to assess circulation in injured patients. You just use it on yourself in under 10 seconds. I want to tell you about a patient who did not come to see me for his nails. He came in for fatigue, which is how half of all serious diagnoses begin their clinical journey. As fatigue, which seems like nothing, which everybody has. He was in his early 60s, retired 2 years before from a logistics company, working long hours for 3 decades. He described his tiredness as just getting old. He was not worried. His wife had made him come. I looked at his hands. The nails had a faint blue-gray tint at the lower third of the plate. The shamroth window was significantly reduced on both index fingers. I asked whether he had noticed needing more pillows at night. He had not connected any of these things. What he said, and I still think about it, was, I thought I was just tired because I was bored. I thought retirement was making me soft. He had not slowed down because he was bored. He had slowed down because his heart was working harder than it should have been, and his body had been conserving energy the only way it could. The nails were showing what months of quiet adaptation had hidden. When your body compensates for a long time without complaint, the silence is not reassurance. It is efficiency. It means what is happening has not yet reached the threshold of pain, and pain is not the first signal. The nails are. What I want you to leave with today is not a checklist. Lists encourage scanning, and scanning encourages dismissal. What I want you to leave with is a habit of attention. Once a month, in good natural light, look at your nails slowly, with intention, without deciding in advance what they say. Look at the color of the plate long enough for any deviation from your personal baseline to register. Look at the lunula and whether it has changed in size or color. Look at the surface texture with your eyes and with your touch. Perform the shamroth check. Remove your socks and check the capillary refill time on the big toe. Then take a photograph. Every month, the same hands, the same light. Over time, you will build a comparative record that tells you not just what your nails look like today, but how they have changed. And change in biology is often more meaningful than any single measurement. Your nails have been recording your health in the same quiet way for your entire life. The record is current. All that is required is the willingness to look, not with alarm, but with the calm and specific attention your body has always deserved. The body is not your adversary. It is speaking to you in the only language available to it, the language of physical change, of color and texture and architecture. Learning to read that language is not anxiety. It is respect. What has changed on your nails recently that you have been ignoring? Leave it in the comments. One word, one detail, something you noticed and set aside. Here's everything we covered. Moving through it one final time. Your nail matrix is a continuous recorder of your internal health, producing changes that grow visibly forward over months. White spots are caused by minor trauma, not calcium deficiency. Horizontal white bands crossing multiple nails simultaneously, Mises lines, or else signal deserving investigation. The lunula's size reflects thyroid activity, and its disappearance may indicate anemia or nutritional deficiency. A blue-gray tint to the lunula warrants evaluation for conditions including copper accumulation disorders. And the overall color of the nail plate is a direct window into your blood. Pale nails point toward anemia, yellow nails toward fungal infection or lymphatic dysfunction, blue-gray tints toward our oxygenation problems. A dark vertical stripe, particularly one that is wide, has irregular borders or bleeds onto the surrounding skin, requires prompt dermatological evaluation. Clubbing, the loss of Shamroth's window, is associated with lung, heart, and liver disease. Bowes lines record specific moments of physiological stress, and their distance from the nail base tells you when that stress occurred. Toenail thickening requires distinguishing between fungal infection and vascular insufficiency, particularly in people with diabetes. A capillary refill time of 2 seconds or more on the big toe indicates impaired peripheral circulation. Monthly photographs and deliberate attention are the foundation of everything else. This content is provided for general health and wellness education only, and does not constitute medical advice or replace evaluation by a qualified healthcare provider. Every person's health situation is individual, and the patterns described here reflect general findings across populations, not guaranteed conclusions for any specific person. If you are experiencing nail changes that concern you, if you have a diagnosed medical condition, if you are taking medications, or if anything discussed today prompts a question, please bring that question to your own physician before drawing conclusions or making any changes to your care.